Welcome back to All Things Creepy. I'm your host, Micah James. This week, I am talking about an absolutely terrifying disease, probably one of the most famous / well-known terrifying diseases out there, rabies. So I do have a few general topics, and we'll get into all of that. But I just wanted to give a little bit of a backstory why I'm giving this topic its own episode. Rabies is just something that's always kind of interested me. Well, diseases in general have always interested me, just learning about them, the symptoms and all of that. But especially rabies, because I ended up watching Cujo at a young age, 9 or 10. And just in case people might say it, I agree. I was a little too young to watch it at 9 or 10. I'm not going to argue with anyone there. But what's done is done. And a few episodes ago, in episode 70, so 11 episodes ago, I did talk about one of the survivors of rabies after the incubation period. I'll go more into the phases soon, and that kind of reignited my interest in it, and I want to look into it and give you guys more information on this, because even when it's well known, I think it's still important to talk about as well. Now, with all of that being said, let's get into this topic. Alright, so we should start with some basics and general prevention when it comes to rabies. So it is very fatal, but it is also preventable. This disease has an almost 100% mortality rate. Basically, once you start showing symptoms, you're almost certainly as good as dead, essentially. When it comes to people and pets, it's typically spread through bites and scratches from infected animals. It'll end up affecting your central nervous system, which will end up leading to severe brain damage and death if it is not treated before symptoms start showing. There are roughly an estimated 59,000 deaths reported related to rabies each year. It is also reported that every continent but Antarctica has rabies. And on top of that, a majority of non-human cases happen in the wild. And it seems like worldwide, it has been most commonly reported in raccoons, bats, skunks, foxes, and stray dogs. There might be other animals that it is been reported in, like wild animals, but again, that has been the most common list that I have found. When it comes to prevention, like I said, there are definitely ways you can do this. That being said, these prevention steps will not guarantee that you won't get rabies, but it'll definitely lessen your risk. So one of the most important prevention tips is to make sure your pets are up to date on their rabies vaccines, because I have read a lot of reports where people have gotten rabies because their pet was infected and then scratched their owner or bit their owner, and it just happened to spread that way. So that's one way that you can prevent it. Also, do not bring the wildlife indoors. Basically, keep the wildlife wild. And kind of to piggyback off of that, if you're worried about a wild animal or a stray animal, please call your local animal control or whatever equivalent you have where you live to deal with it. They'll know how to properly trap it and be able to be safer than you dealing with it yourself. If you end up getting a wound, immediately wash the bite or scratch with soap and water. This is a good injury tip in general. If you get some sort of cut, go wash it, because it does prevent infection in general, but especially if you suspect that the animal you got the scratch or bite from could have been a carrier of rabies. And finally, seek medical attention very shortly after potential exposure. Basically, get help ASAP, even if you have to go to urgent care, the ER, whatever you have to do to get that medical attention. Now, much like a lot of diseases, it does kind of go in phases. Like even with like a common cold, the common cold does kind of have its phases. You kind of start your face might start getting hot, then you kind of feel a little weak, your bones ache, that kind of thing. So in very similar fashion, rabies does have different phases, and there are 4 main stages of it before it ends up leading to death. Each phase does have increasingly concerning symptoms, which we will cover in detail like in the next section of this podcast. But again, for now, let's focus on each stage. Bear in mind that the information that I'm giving you is a basic summary of each of them and can vary from patient to patient. So the first stage is incubation. So basically, this is where you are potentially infected by the animal, and symptoms can take anywhere from days to weeks to show up and reach your nervous system. At this stage, there are no active symptoms besides perhaps anything that comes with getting a bite or scratch, like redness or soreness or some type of tenderness around that wound. You are able to still get treatment while in this period, which is why it's so important to, get to urgent care, your own doctor, whatever it happens to be. The next stage is where symptoms start showing and it might be too late for you. It's the prodromal stage. This phase will last about 2 to 10 days. And as I said, this is the point where things start getting rough. The disease by this point will have traveled through the nerve cells to the brain and would have caused nerve damage. Now, how much nerve damage, like I said, really varies from patient to patient, like many of these. But at this point, you will start feeling flu-like symptoms and have possible tingling pain and or numbness around the injection site. So as soon as you reach this stage, like I said, there are unfortunately you're unfortunately almost SOL. It's like there's really no truly effective treatments by this point. The third stage is the acute neurological phase. Once you get here, you will have brain and spinal cord damage. From here, there are one of 2 ways you could be affected. You'll either get furious rabies or paralytic rabies. 2/3 of patients will suffer from furious rabies, which lasts anywhere between a few days to a week, and others will suffer from the paralytic rabies for up to a month. And the final official stage is coma, and this is the final stage before death. At this point, there are really no other symptoms, no other new symptoms besides dying. You could argue that there's technically a 4th stage or a 5th stage, which is dying. But as far as by that point, you're not really being affected by it anymore. I guess you could say that's the unofficial final stage. All right, so now let's talk about some of the symptoms. Before we get into the symptoms, during the incubation phase and the coma phase, there really aren't any symptoms. Like as I mentioned, the incubation phase is just when you're when it kind of just enters your body. So other than possibly feeling the typical pain or itchiness or whatever from a bite or scratch, you're not really gonna feel any actual rabies symptoms. And as far as the coma phase, as I said, the only real quote unquote real symptom that you get from the coma phase is death. So that means that there are 2 phases where you actually get symptoms, which is the prodromal phase and the acute neurological phase. When you're in the prodromal stage, it includes, but is not necessarily limited to the following. You'll get a fever, experience tiredness or fatigue. The wound might start burning, itching, tingling, and or becoming painful, or at the very least more painful than it already was. You might start coughing and get a sore throat. You'll experience muscle pain. You'll end up feeling very nauseous and might end up vomiting. And finally, you might end up getting diarrhea. Now, during the acute neurological phase, like I said, there are 2 main branches this can take, and both branches kind of have different symptoms. If you end up getting furious rabies, you might end up experiencing agitation or aggression. restlessness, seizures, experience hallucinations, get muscle twitching. You'll definitely get a fever, and if you already don't have a fever, your heart will really start racing. You'll start hyperventilating. Basically, you start breathing really fast. You'll start to excessively salivate. Your pupils will have 2 different sizes. You might experience facial paralysis and might be the most famous symptom of rabies, but you might also end up experiencing hydrophobia, or the fear of water. You might end up also experiencing aerophobia, which is the fear of air being blown in your face, or drafts, as well as delirium. So, as I said, 2/3 of people will experience this kind of rabies near the ending stages. But for everyone else who might get paralytic rabies, you might end up experiencing, once again, a fever. You might get headaches, neck stiffness, weakness, a tingling or pins and needles sensation, as well as, you might have guessed, paralysis. So it's like these symptoms are like exactly the reason why if you suspect that you might have been infected, to get help as soon as you can. All right, so to kind of round out this episode, because I do feel like it's kind of a bummer, let's talk about some survivors. I mean, it's not as happy as I would like to end this, but it's as happy as I can end it. There seems to be 30 well-documented cases of people surviving rabies past the incubation period. However, the survival rates seem to vary, with only 3 that seem to have survived for years afterward. Although I could only find like details about 2 of them, or at least enough detail to talk about them. The first one is Gianna Geese. Now, as I said, I do talk about Gianna in episode 70. So I would recommend, after you finish this episode, to go ahead and listen to that episode if you want more details about her. But as far as basics go, she ended up getting infected by a bat and was put into a medical coma before given this experimental cocktail treatment that included an antiviral medications. This treatment was later dubbed the Milwaukee Protocol, which I don't think I mentioned in episode 70. All this happened while she was being treated in a Wisconsin hospital. Now, this kind of piggybacks off of Gianna's case, but there was an unnamed 15-year-old Brazilian boy who happened to be vaccinated from rabies. Unfortunately, the rabies had progressed as his body was trying to develop the proper immune response. To treat this boy, the doctors used a very similar technique to Geese's case, and there was another, like, kind of like, as far as I could tell, another unnamed girl who also got something similar to the Milwaukee Protocol. And it seems like a lot of these other cases used that same protocol or something very similar to it. But again, for a lot of the cases that I was able to find even like a sliver of information about, it very much varied with how long they survived after the fact. And as far as I could personally tell, Gianna Geese seems to be still living and thriving, and she's pretty much living a normal life. She did have to kind of learn to walk and talk and all that again, but she did end up graduating with her class, if I remember correctly. But again, please go listen to episode 70 if you want more information on her. All right, so that was my episode on rabies. Now, if you guys know any of any other stories that are a little bit more well documented than I personally mentioned, please reach out to me, because I would not mind doing kind of like a follow-up episode about survivors of rabies. But again, Gianna's is probably the most well-known case, so that's the most information that I could find on any of the survivors. Now, with that being said, I'll see you guys next week. I might do another disease-related podcast at a future date. And please recommend me some horror movies, disturbing documentaries, horror anime or show or other shows, because I am in the planning stages of starting a new podcast that is going to strictly be about movies, documentaries, and TV shows in the horror realm. So yeah, be on the lookout for that as well, and I'll see you guys next week. Please be safe out there.